In the last class, we saw catabolism of purine nucleotides, and the end product of purine nucleotide catabolism is uric acid. Coming to the reference range, in males it is 3 to 7 milligrams per deciliter, and in females it is 3 to 5 milligrams per deciliter or 2 to 5 milligrams per deciliter. If these levels increase, and we call it as hyperuricemia. So hyperuricemia can lead to precipitation of monosodium urate crystals in the joints and causing inflammation and pain in the joints called gouty arthritis. So swelling, inflammation and pain of the joint due to monosodium urate crystal deposition is known as TOFI. Now coming to classification of gout. Gout can be classified into primary gout or secondary gout. Causes of primary gout, in 90% of the time it is inherited enzyme defect, and in 10% of the times it is idiopathic, that is cause is not known. In secondary gout, it is due to other diseases or other clinical condition resulting in hyperuricemia. Apart from this, gout also can be classified as metabolic gout and renal gout. Primary gout is due to inherited enzyme defects. For example, abnormal PRPP synthetase, abnormal glutamyl PRPP amidotransferase, HGPRTase deficiency, glucose 6-phosphatase deficiency, and due to abnormal glutathione reductase. Now we will see the biochemical basis behind these enzyme defects which causes hyperuricemia. So when we have abnormal or hyperactive PRPP synthetase, that is, this variant enzyme is lacking the allosteric regulation. So there is no allosteric regulation on this abnormal PRPP synthetase. Once it is not subjected to allosteric regulation, there is overproduction of PRPP because of its hyperactivity. So once there is increased PRPP, it leads to increased purine synthesis. Thereby there is increased purine degradation, and the degradation of purine leads to uric acid production, which causes the hyperuricemia. Now coming to the second enzyme defect, that is abnormal glutamyl PRPP amidotransferase. This abnormal enzyme also not sensitive to usual feedback regulation. So because of this, there is overproduction of again purine nucleotides, results in increased uric acid production. Now coming to the next enzyme defect, that is HGPRTase deficiency. So this is the enzyme of salvage pathway. So once this enzyme is defect, there is increased substrate, that is hypoxanthine and xanthine. So there is accumulation of hypoxanthine and xanthine, and also PRPP is not utilized in salvage pathway. So this also leads to accumulation of PRPP. So they all lead to increased purine biosynthesis, and there is more production of uric acid. Apart from this, there is also decreased IMP and GMP, which decreases the inhibition of purine synthesis. Other enzyme which causes primary gout is glucose 6-phosphatase deficiency. So already you know deficiency of this enzyme causes type 1 glycogen storage disorder, that is Van-Gerkes disease. So when there is deficiency of this enzyme, glucose 6-phosphate cannot be converted to glucose. Then there will be accumulation of glucose 6-phosphate, which increases HMP shunt, resulting in excess formation of ribose 5-phosphate and PRPP, which in turn causes purine overproduction and catabolism, finally leading into accumulation of uric acid, that is hyperuricemia. Further, there will be increased glycolysis leading into lactic acidosis, which impairs uric acid excretion because uric acid and lactic acid competes for the excretion in kidney. So both these mechanism increases uric acid content in the body, thereby causing gout. Then we have one more enzyme abnormality, that is abnormal variant of glutathione reductase. This enzyme converts oxidized glutathione to reduced form utilizing NADPH, which is generated by HM patient. So abnormal activity of this enzyme causes increased production of ribose 5-phosphate and thereby PRPP, eventually leading into hyperuricemia. Among the above mentioned inherited metabolic disorders, glucose 6-phosphatase deficiency is an autosomal recessive trait, whereas both HGPRT deficiency and hyperactivity of PRPP synthetase are X-linked recessive trait. Now we will see the biochemical basis for secondary gout. As secondary gout can be due to increased uric acid production or due to decreased excretion. But if you see the primary gout, it is mainly because of more production of uric acid. Coming to the causes of secondary gout. So conditions where there is increased tissue turnover, for example, in medical condition, in a dermatological condition, that is psoriasis, where there is increased tissue turnover, or cancerous conditions like leukemia, polycythemia, or lymphoma, where there is rapidly growing malignant cells, or when there is increased tissue breakdown. For example, when we are treating a cancerous condition with radiotherapy or chemotherapy, or a person is having some trauma or starvation. So in all these conditions, the cells are lysed, which releases the nucleic acid. So there is more production or there is more release of purines. Again, there is catabolism of purines, which releases uric acid. So thereby hyperuricemia and gout can occur in these conditions. Apart from this, the secondary gout can be seen when there is decreased excretion of uric acid from the body. For example, in chronic alcoholism, renal diseases, lead poisoning, and preeclampsia, all these conditions where there is compromised kidney, so which leads to decreased uric acid excretion, thereby increasing its serum levels, that is hyperuricemia, and which can progress to gout. Now we will see how this patients with gout presents. Usually it is a sudden onset. So the patient will be apparently normal but suddenly comes with a severe pain in the affected joints. So once there is accumulation of these urate crystals, it is going to damage the synovial membrane, thereby causing the inflammation and swelling. Once we have inflammation, there will be redness and temperature increases. So this affected joint is known as tophy. The most common joint which is affected is the first metatarsophalangeal joint, that is the great toe. This is the most common joint with which the patient will come. There is a swelling and severe pain. And this clinical manifestation can be precipitated by high purine content diets. So high purine content means the non-vegetarian meat, red meat, poultry, fish, they are rich in purine, so they might precipitate the attack of gout. Apart from this, alcohol consumption, especially the beer, also precipitates the condition. So this is the tophy, and once we have this arthritic change, we call it as gouty arthritis. So tophy is nothing but the inflamed joint. There is swelling, there is redness, and also temperature is increased. So because of this inflammation, the patient might be associated with fever, leukocytosis, and elevated ESR. Other complications with which patient might come up to the doctor is urolithiasis. So this is the renal stones. Sometimes if it is very chronic, they also presents with renal calculi, and sometimes they might come with renal damage. The investigations which are done in gouty arthritis are a simple one, that is estimation of serum uric acid level. So in gouty arthritis there will be hyperuricemia, that is increased uric acid levels in the body. If the levels goes beyond 7 mg per deciliter in males and more than 6 mg per deciliter in females, it is actually a diagnostic feature of gouty arthritis. Apart from this, microscopic examination of synovial fluid also can be done. So you can aspirate the synovial fluid and send it for microscopic examination where it reveals uric acid crystals. That is, you can see rod or needle shaped crystals, and if it is visualized under polar microscope, you can see birefringent crystals. That is, they will have two different refractory index. Treatment of gout. So treatment can be targeted at reducing the joint inflammation by using anti-inflammatory drugs. It can be targeted to increase the uric acid excretion by using uricosuric drugs. And also it can be targeted by decreasing uric acid production, that is using xanthine oxidase inhibitors. So anti-inflammatory drugs, we have colchicine, NSAIDs and COX-2 inhibitors can be used to reduce the acute inflammation of the joints. So uric acid excretion can be increased by using uricosuric drugs like probenecid, sulfapenrazole and high doses of salicylates. Xanthine oxidase inhibitors, for example, we have allopurinol and febuxostat, which will decrease the production of uric acid. Now we will see the mechanism of action of these two drugs. Already you have learnt in clinical enzymology the mechanism of action of allopurinol. So allopurinol, if you see, it is structurally similar to hypoxanthine by just an interchange between C8 and N7. So this is C8 and N7. So they are interchanged. Apart from this, they are almost similar. So because of this structurally similarity, this allopurinol actually competes for binding to xanthine oxidase. So once it binds to xanthine oxidase, it gets converted into a potent inhibitor, alloxanthine. Now this alloxanthine irreversibly inhibits the xanthine oxidase. Now you can see the product itself is inhibiting the enzyme. That's why it is a suicide inhibition. So apart from this, we have one more drug, that is febuxostat. This is also an inhibitor of xanthine oxidase, but if you see the mechanism of action, it non-competitively blocks the molybdenum pterin, which is present in the enzyme xanthine oxidase. So which is an active site of xanthine oxidase. So the active site of xanthine oxidase is inhibited by this. So that means this also causes decrease in production of uric acid. So by these three mechanisms, the gouty arthritis can be treated. Apart from this, other protocols like use of low protein diet, avoiding alcohol and caffeine, drinking lot of water can also be used during the treatment of gout. We all know that prevention is better than cure. So once a patient is diagnosed with gout, so we can advise the patient with these dietary guidelines and some lifestyle modifications which may help him or her to protect against future gout attacks. So you can advise to drink plenty of fluids, that is water, limit or avoid alcohol, especially beer, and also sweetened beverages, that is which is having high fructose or corn syrup. And also we can advise to get protein from low fat dairy products, and also advise to limit intake of meat, fish and poultry, and to maintain a desirable body weight.